and welcome to another episode of the Project Purple podcast. I'm Dino Verley, founder and CEO of Project Purple, and we've got an exciting interview coming up with a very special guest after a few quick updates. Since 2010, we've contributed over $3 million and counting to pancreatic cancer research efforts. We've also allocated over $1,300,000 to patients and families through our patient aid programs. Your monthly or one-time gift can improve patients' lives through research and assistance programs. You can donate now at projectpurple.org. Pancreatic cancer does not rest, and neither will we. Your support is truly appreciated. If you're looking to get involved in one of our events, whether that means joining a run team, participating in a virtual run walk, group fitness, golf, or anything else you can think of, visit projectpurple.org/events to learn more. Without further ado, let's meet our special guest coming to us all the way. I always say all the way, but like everyone is all the way. Like there's always a distance in between from where we sit and where our guests sit. But coming to us from northern New Jersey, Bergen County, Jaclyn Lin, welcome to the Project Purple podcast.
Hi, Dino. Thank you for having me today.
Well, thanks for taking the time. I know we were playing a little catch up. It's as we record this, there's been some crazy weather here in our part of the country. I know it's towards the end of the summer, and well, you know, living in New Jersey, like this is like hurricane season, right? Especially for us in New England. So we had some nasty weather come through yesterday, and but it's great to have you on. Thank God. Hopefully we won't have any technical difficulties here as we record this. But this is exciting to have you on. As I said in the beginning, you know, this podcast, it's just awesome when we bring people on to share kind of their journeys and their stories, because it's why we do what we do. And it's the reason why I get up every day, and as is the staff. And I think the podcast has really grown. As I mentioned, we're almost over 300 episodes. Well, we'll be probably over this as we've got some recorded here. But, you know, being able to share journeys and stories, I've always said on the podcast, I've mentioned this and I've said it in person, like, we get to meet everybody, right? We get to meet the survivors, the clinicians, the participants. And sometimes that's hard to share that in a context way, whether that's in writing or, you know, just face to face when we're meeting participants or we're meeting those kinds of people. But having the podcast, and now that we use the video for so much, because social has gone so much to video, is just really awesome that the people themselves can share their journey. So it's made our job a lot easier, I feel, with the podcast, not only having the audio, but now the video to allow people the opportunity to share that. So I always love bringing people on the podcast. It's one of my favorite things of being here at Project Purple and the job that I do. So I'm going to stop talking. And as I said, the first segment's always the guest opportunity to kind of share their journey, their story. I'm sure your friends and family will be listening in and they'll know, but there's probably a lot of people out there in the community that know nothing about you, and this is the first time they're hearing it. So with that, I'm going to hand over the microphone over to you and give you the opportunity to kind of share your journey.
Sure. Thank you. So my journey started a year ago. So this podcast couldn't be more timely for me. Celebrating my 1-year cancerversary, as they call it. August of 23, I was 35 years old, pregnant with my second daughter, and experiencing excruciating back pain and flu-like symptoms. So I would have a fever, chills, and body aches. I went to the L&D unit at my local hospital several times at the advice of my OB. They would always check on baby, make sure baby was fine, and then basically chalk it up to pregnancy symptoms and release me. That recurred, 2 or 3 times before I finally landed in the hospital a third time. And that time I was admitted, and they decided to do a workup on me, not just baby. So 2 months of me asking them to keep looking because my symptoms weren't resolving. Finally, they did an abdominal ultrasound of me, and they found lesions on my liver. And then that led them to go further and order an MRI. I think they were just hesitant to do all of this imaging because I was pregnant at the time, which I totally understand. But it took advocating for myself to get there. So the MRI then revealed the tumor on my pancreas. And that was August 8th of 2023 that news was delivered. Um, Obviously pregnant at the time, so I had to decide when to do a biopsy, because that would be the next step in all of this to determine if it was cancerous or not. So I met with the team of medical staff, and initially we thought we could do it while I was pregnant. They, informed me of all the risks, and after, evaluating them and deciding with my husband, we decided that we would do it while I was pregnant, so that way baby could stay in as long as possible. Um, and we wouldn't have to deliver her so prematurely, because I was probably about 33 weeks at this point. Um, so we were about to do the biopsy. I was at the hospital. But in the 11th hour, the hospital team decided that they weren't comfortable. So in their pre-procedure huddle, one of them raised a red flag, and the entire team came into my room and told me that, we're going to pump the brakes. We don't think we're comfortable doing this. And to be fair, it was more of a local community hospital, so not a whole lot of experience with probably doing this procedure while pregnant, because it's pretty rare, but also not a lot of experience with the 35-year-old with pancreatic cancer. So at that point, I had already been in touch with an oncologist down at Robert Wood Johnson Barnabas Health. I was an employee there at the time, contract employee. So I knew the medical staff and was able to get in pretty quickly. I literally thank them with my life at this point, because they saved me. So the oncologist then consulted with my OB and high risk OB, and then a neonatal provider as well. And we decided that we were going to deliver my baby at 35 weeks and then do the biopsy post-delivery. So on August 21st, a couple of days from now, my daughter will be one. So on August 21st, 23, we delivered my daughter. She was in the NICU for about a week. And then I had the biopsy done 4 days postpartum. So it was a very emotional time. Sorry for my family. As we had to, juggle a newborn and then also a new cancer diagnosis. That's not something that many people have gone through, and there's no roadmap for it. But thankful that my baby was healthy. So she was only in the NICU for a week. And then the biopsy came back a week later. But I didn't make it home a week. 2 days before the biopsy came back, I actually ended in the emergency room at a different hospital near me, with excruciating right side pain. And I say excruciating to like the nth degree, because I had just delivered a baby, so I knew what pain was like, but this pain was worse than labor pains. So we did a CT scan at the hospital then, and it revealed the extent of the cancer, which the radiologist used the word innumerable when it came to the liver mets, something that nobody ever wants to hear. They couldn't even count them. So my liver was also, gosh, probably triple the size of a normal liver. It literally encompassed my entire abdomen. So that is why I was in such pain, pregnant, and why I was in so much pain now. So after that, my doctor, my oncologist, rushed the lab to get my biopsy results returned. And it came back with stage 4 pancreatic adenocarcinoma, which we were bracing ourselves for, but I don't know, you always want to have that sliver of hope. And there was also the chance that it could have been neuroendocrine. The doctors who initially didn't diagnose me, but found the liver mets and the pancreatic tumor, said that it was presenting itself like neuroendocrine, which typically has a better prognosis, not always, but in some cases does. But no, it was adenocarcinoma, stage 4. And that really hit. um, I immediately had to tell my parents the diagnosis, my family, and I was transferred from the hospital up here in North Jersey to Robert Wood Johnson down in New Brunswick to start chemo as an inpatient. I was in so much pain they couldn't release me. So I started chemotherapy on September 2nd. So coming up on my 1-year anniversary of chemo. And I was in the hospital about a week. Did my first cycle of FOLFIRINOX. And I've done 25 more cycles since. So it's been quite the ride. Initially, I lost a lot of weight. I wasn't eating, nauseous, very nauseous after the chemo treatments. It was pretty rough, I'd say, for the first 2 to 3 months. So it was probably around the November timeframe that I was finally regaining some of my strength and some of my appetite. And that was all a sign that the chemo was working. So with my first scan, there was about 40% reduction in my tumors. And I was, thankfully showing a great response to the treatment. So that November, after, several months of literally going through hell, I was feeling good. And after Thanksgiving, we took my then 2-year-old to Disney. So my husband and I went on a trip at the recommendation of one of my oncologists that I had met at UPenn. She said, start planning your life in 2 to 3 month increments. And that really hit home. So we planned our first family trip. We left baby at home with our nanny. So we had full-time childcare for our daughter at that point. And we also had the help of my parents and my husband's parents. They flew all the way around the world from Taiwan to come stay with us. And my parents, who live in Monmouth County, came to help with the baby while we were away. So we were all hands on deck. My siblings were, there from the start also. I mean, my sister stayed with me while I was going through inpatient chemo, and my stepsister, Angela, was there to help with my daughters also. So we wouldn't have made it through those first 2 to 3 months without everybody. I think the hardest part of all of this was not being able to care for my children, especially my new baby. In the beginning, I was too weak to hold her, to care for her. I had a chemo port. I came home connected to chemo. So that was just very difficult, not being able to be the main caregiver, like the mom is supposed to be. And thankfully now, as I look back a year ago, I can say that I'm stronger and healthier and made it through the darkest moments of it so far. That's not to say that there won't be more difficult moments ahead, because with pancreatic cancer, as anybody knows, you're never out of the woods. I am still going through chemo and, going through the motions, but I am having a good response, and I'm stronger and healthier, and have been able to spend the summer with my daughters the way any other mother would. So there's obviously a long road ahead. And, chemo is not easy. I wouldn't I wouldn't wish this on anybody, but um, it's tolerable. I've been able to tolerate it well, and been able to make it through um, 26 cycles. So there are options going forward in terms of treatment.
Yeah.
Um, and we can cover that part next.
Yeah, I just want to jump in here real quick, Jaclyn. So, like hearing your story, I mean, like it's just wild because like as you said in the beginning, like I don't do a lot of research on my guests. Like, I know a little bit. And when you came on, I was like, oh, okay. I'm like, is she a runner? Is she one of our runners, participant? Um, and then just to hear, I mean, it's just so crazy. I mean, there's something, I mean, I think this is, and I mentioned we say a lot of things, but there's something that I think is very interesting in the last like 4 years. Like we've had more and more people from 28 to 40 on our podcasts. And I think you are a testament, like, just hearing you tell your story. And I'm like, oh my God, like I have two kids and this week we're going to send my two sons, they're 18 and 20 away to college and we're going to be empty nesters. So I remember those days like it's very fresh in my mind because we're at this momentous occasion where we'll be, shipping both of these boys off to college. And you think back at like the life. And so hearing you tell the story, like, okay, so you just like deliver your daughter and also early, which is, stressful, but then you go right into the storm, right? And you go right into not being around that child and just like I can't imagine, as a parent, your husband and even your family, man, like just what's going on, and but also for you. So I guess the first question that I have, and I know you said something before, like when you're pregnant, like a lot of things happen, I think, to women, and they feel, that's just the pregnancy, right? Like indigestion, right? Back
Yeah.
pain because you have this baby, in the front, and they as the baby starts to grow, it gets a lot harder. So some of these things like back pain is a sign and symptom, right? Like indigestion or GI issues, like that's a sign and symptom. But I guess if we look back, and I know like hindsight's always 2020, and the reason for this is not to beat yourself up. But was there anything beforehand like that you could like have pointed to and that would say like like oh I had this episode when I was like 28 before kids, I had this like GI issue or this back issue that just wouldn't go away. Was there anything like beforehand or any family history that in terms of cancer?
No family history. So completely spontaneous, like no history of pancreatic cancer at all in my family. A couple of my dad's relatives had melanoma,
Yeah.
but nothing pancreatic, no, abdominal cancer at all. Um, and honestly, like there were no symptoms before. I had a healthy pregnancy with my first daughter. Um, then went, through raising her for a year and a half before, I became pregnant again. And it wasn't until I was about 20 weeks pregnant when I felt 40 weeks pregnant.
Hmm.
And I was like, something's not right here because I, was losing my appetite. I wasn't hungry as often. And, you get cravings when you're pregnant. You're supposed to be hungry. But there was none of that. There was just very strong discomfort. Like I just felt like she was squished in there and she was always kicking, which also, babies kick in utero, but not to the extent that I was being pummeled by her. And, it turns out that she had no space. So, I mean, I understand why now she was, so active in the womb because she was trying to make space for herself. My liver was so severely enlarged that it was, taking up half of my abdomen at that point, I'm sure. because it got even worse, obviously, by the time September rolled around and that CT came. Um, and they actually, scheduled an induction for me to have her prematurely. But when I got to the hospital for my induction, I was already 2 centimeters dilated. So she was coming early, whether, we were planning to or not,
Mhm.
because she wanted out. And,
Yeah.
there was just no more space. Um, so there were no signs. I don't know when this would have started or how aggressive it, started out of the gate. But they say it could take years, but I was never jaundiced. I was never, any of those visual signs that would, tip you off to say, okay, let's check this. Um, the only thing that could have, helped a little bit earlier was my liver enzymes. When they ran some of my blood work, my liver enzymes were elevated. And that can also happen in pregnancy, though. So
Yeah.
the doctors were originally kind of focused on my pregnancy and baby and the fact that it could be HELLP syndrome, which is kind of a preeclampsia type scenario, but with elevated liver enzymes. And that would mean I would have high blood pressure, but I never had that. So that was, kind of ruled out, but always kind of lingering as a potential cause of, why I wasn't feeling well. But I think the doctors were as shocked as my family when they found that it was pancreatic cancer, because that was on nobody's radar. Nobody, I think, understood the extent of which I wasn't feeling well, because I didn't look unwell. I mean, going
Yeah.
in diagnosis, I mean, I just looked like any other 35-year-old pregnant woman. I didn't look ill.
Yeah, it's fascinating. I mean, I know we've heard stories of pregnant women who, and not with pancreatic cancer, but other cancers. Like I've read stories about breast cancer, about lymphoma, right? Like people, and I haven't seen the scientific data and not suggesting this, but it's fascinating though, like that there are women out there that, and have babies and the babies are fine, but then like boom, like right after they're done delivering, like they're in the treatment, right? And it's just so fascinating. And I know I've talked to some people and they've said like or read, like if they didn't, if they weren't pregnant, I don't know if they would have discovered the cancer prior
Right.
to being pregnant, right? Because like to your point, like, the baby's kicking like crazy and you have all these crazy pains. Like if the baby wasn't there, like, I don't know, maybe it
I
wouldn't.
would have thought
Yeah.
twice going to the doctor, because
Yeah.
again,
Yeah.
I'm 35 and healthy. I mean, I'm not obese, not pre-diabetic. Not, there was no other underlying condition.
I know this is probably and I ask this question often, but I'm sure listeners are saying, Dino's going to ask this question, and I'm sure, they've done this, but genetics, like genetic testing, anything come out through that? Because I know that that is a requirement now. I know you said there's no family history, so I'm assuming that nothing came out of it.
Nothing, family history wise. I don't have the BRCA gene, so I'm not a carrier of that. They did find actually a unique gene mutation, which is an NRG1 fusion, which is actually pretty commonly found in young onset pancreatic cancer. Um, my husband has done extensive research, bless his heart, on pancreatic cancer since all of this. And he's actually found and come in connection with 3 other individuals who have this NRG1 fusion. It's very rare. It's found in like 0.5% of all pancreatic cancer cases. Um, so there are others like me out there. Um, and 2 of them also happen to be in their 30s. Both of them are males, but within my age bracket. So just I guess something that's becoming more common in younger people, like you stated earlier, you're finding more young people on your podcast. So pancreatic cancer is no longer just an old person's disease. And that's why the statistics I think are so scary from the outset, because it's looking at individuals who typically, receive this disease or are diagnosed at an older age. So they have other comorbidities and not able to tolerate the chemo as well. So not able to make it through it. So that's why pancreatic cancer has, the stigma it does about being deadly. And, the 5-year survival rate is still only 13%. But I believe that it could be higher because young people could help with those statistics. Not saying that everybody is fortunate enough, but I do feel that I've been fortunate the past year to help push those statistics a little bit further.
Yeah, I think you bring up a very valid point, though, and something, I mean, I've said this before. This is a fine line that we walk in statistic world.
Mhm.
I think the statistics are important, but I don't think the statistics are as accurate as they present themselves. And how do I mean by that? I'm not saying I'm a conspiracy. This is not a conspiracy theorist here, but or a conspiracy theory. I think yeah, the statistics are close, but I think there should be like a +5 on the statistic because I don't know if there's someone actually going out there like polling people, right? And you're like something you just said is like really poignant, which never really thought of, but like you think about like there are a lot of I know there are a lot of younger people because I'm meeting them through this podcast, right? And young people tend to do better, it seems, with the tolerability of these treatments. In my opinion. Now, this is my opinion. It's not medical advice, but someone who's been in the space now going on 15 years, and I talk to a lot of people. So there might be something in there where, like to your point, like yeah, like younger people tend to be like better shape, don't have as many comorbidities, and potentially may be able to tolerate the toxicity of these chemotherapies better than someone who is, in their 70s who may have a comorbidity or and I'm not saying like, yeah, there's always outliers, right? Like there's a 70-year-old who like, does Pilates like 5 days a week and, has a BMI that's like perfect, right? And doesn't have any comorbidities. Like there's always going to be those outliers and we see them. I know someone who's in their 80s and they're that person and they've been stage 4 for almost 2 years now and they do FOLFIRINOX and they go in every two, I think they're on a 3-week cycle and they're getting through it, right? But usually people in that age group are, not that case, right? So maybe there is something here where it'd be interesting to look and see what the data. I have asked around, and the only data that there is which you fall into here, Jaclyn. There is some data that shows that women under 50 are being diagnosed at a higher rate right now. There and I think that's something that is kind of obvious that I've seen, but that's the one data point that I've seen. But my point in the numbers, like I've always kind of questioned it over the last 5 years, probably coming out of COVID. And I know, and again, this is not a conspiracy theory here. I'm not trying to be a theorist or whatever, take it for whatever it's worth, just in my experience and what I read and what I see and who I talk to, who we've had on the podcast and, within the community. But I also do know, and this is fact, like cancer rates are exploding, like not just in pancreatic cancer, like colon cancer rates are like, when we talk to GI specialists and, they're doing colonoscopies now on 30-year-olds and 25-year-olds, which like 5 years ago, that was not the case. Right. So there is something going on. We don't have the answers, unfortunately, but I think going back to your story here, like it's a testament of strength and perseverance. I do want to talk about the chemos, and you mentioned this. Like Flornox is, we call it the kitchen sink, right? It's the nasty, it's the worst thing they can throw at you. You've done 26 cycles. I know you said like, hey, it's not easy. Is there anything in that 26, these 26 cycles that you found have made it easier? Like, are you doing something outside, the normal prescribed that, has able to get you through that?
So, well, just I've done 11 cycles of FOLFIRINOX.
Okay.
After the cycle, I had to drop the oxaliplatin. Um, Typically, people have an adverse reaction after X amount of cycles. And then I also um, did FOLFIRI for the last however many.
Yeah.
So, but I didn't do anything out of the norm. I did the cold therapy because I didn't know about it. So I just started. I mean, it was literally life or death back on September 2nd. So it was, let's get started. There wasn't any time to dance around the issue. So I didn't know about cold therapy. So I have neuropathy now. It still lingers, but it's better. I stopped the oxaliplatin in February. So been off of that for a while. Um,
And that's
but no,
usually what gives you the oxyplatinum is usually the platinum. For the audience listening, the flurdox, is a multitude of drugs. Oxyplatinum. So it's interesting. Like the oxyplatinum, we know works really well with genetic mutations, and I think this is somewhat of the frustration of the disease is like we just don't know, right? So when they throw what I said, like the kitchen sink, usually with someone who's young, I'm sure they're, the protocols to throw the hardest thing at it, especially at, if you came in at stage 4, where they can hopefully knock this thing down and have a positive result. But the lingering, like, oxyplatinum creates a neuropathy, which is just really, really difficult to deal with.
yeah, I mean, for a while there, I couldn't put on a necklace or put my earrings in because, you just have no sensation in your fingers. It's still lingering in my feet. So, sandals and sometimes I try to avoid, but it's a lot better now. And yeah, I think because I've been responding so well, I don't really have nausea after my treatments anymore, thankfully. Zofran was like my best friend for a while there, and ginger chews and all of that stuff. But I mean, I think the biggest thing that got me through it was Ensure shakes, honestly. From September to November, I lived on Ensure shakes. I couldn't tolerate any solid foods. Things were just coming back up pretty regularly. So, yeah, thankful for Ensure shakes. And I never want to look at another one again. um, but yeah, now I mean, I eat what everybody else eats. I take Creon, which is an enzyme that helps, my pancreas process the food. And I'll be on that for the rest of my life, which is totally fine. If I have to take a couple of pills with every meal, I'll do it. And if I have to do this palliative chemo or maintenance chemo, whatever you want to call it, to keep the cancer at bay, I'll do it for as long as it works. I mean, the day after, I'm pretty much out of commission. So I go for chemo every other Wednesday. The Thursday, I'm pretty much in bed because of fatigue and just feeling crummy. Yuck is how I describe it. And Friday, I go for my disconnect appointment because I do come home with the ball of chemo with the 5FU.
Mhm.
And by Friday, when I'm disconnected, I'm feeling probably 80% better. So I like to say I have, about 2 to 3 bad days and 11 good days in a 2 week period. So I'll take 11 good days any day.
Powerful. So right now then the treatment protocol is like are you saying, I know you mentioned something like maintenance or palliative. So are you just like in this routine now of just like maintenance chemotherapy? Like the scans look good, like nothing, like the liver's gone back to its normal size and
Yeah, yeah, the liver's returned to its normal size probably since December. Um, so it was a pretty quick response that I had. They still haven't really counted the liver mets. They don't use the word innumerable in the reports anymore, but they don't give a number either. I just know everything is significantly decreased in size. Um, and my liver enzymes are all in normal range. My CA 19-9, which is a lab value that measures, cancer antigens for pancreatic cancer, was in the over 200s at its highest, and it's now 14.
which is
So
normal.
normal.
Yeah.
So My CT scans up until the most recent one have all showed tumor reduction. The last one showed just kind of stable state.
Yeah.
It was a little defeating, I will say. Obviously, you're always looking for that decrease or progress. But my oncologist, has been very reassuring that I've had a great response so far, and she doesn't see why it wouldn't continue. Obviously, at some point, chemo will stop working because cancer mutates, and that's just how it works. So we're just riding the chemo wave as long as we can. And then once we, discover any kind of disease progression, there is a clinical trial that I'm eligible for through this drug by Merus called Zeno. It has a longer name that I'm not going to try to pronounce, but it's specific for my NRG1 mutation. So they've shown, pretty promising results with it. It's not a cure.
Yep.
So some people, have lasted up to a year on that drug as well, helping to, reduce or keep the cancer at bay. So I'm hopeful I'll get some more mileage out of that. And then there's, other drugs that also target the same, NRG1 pathway that are available. And I mean, at this point, the name of the game is just, getting as much mileage out of each option until there is a next. And I think where my husband and I stand right now is trying to advocate as much for young onset pancreatic cancer as we can in my particular gene mutation. Since we've found other young people with the same, scenario, it seems to be pretty common, although still rare, because pancreatic cancer itself is rare in young people. But this NRG1 fusion seems to be a big player for young people. And to get more funding, more research, to look at this the same way, there are other options for BRCA and HER2 and all of the other, gene mutations. That's where we stand right now.
Has anyone, and I'm sure maybe the audience listening thinking this too, I mean, given your age and where you are and stable, has and I don't think you mentioned where the tumor was. Has anyone brought up surgery as a potential option at some point, potentially if like things were going in the right direction?
Yeah, I've asked my oncologist about it, and I mean, she's a world-renowned oncologist. I'm sure many of your other podcasts folks have had her, Dr. O'Reilly out of MSK.
Yeah.
She said nothing's off the table, but because it's metastatic and it's in my liver, it's not an option right now. So we need to, get the liver under control and reduce the tumor burden there, quite frankly, to none. And then we can, remove the pancreatic tumor.
There's so much happening. And I think you said something like, that there's potentially this clinical trial, right? But there's so much happening. And I know it's easy for me to say that. You're the one in the fight. But there's like, in the last like 3 years, I feel like out of COVID, like we came out of COVID and, whatever, COVID was COVID, right? And we've kind of moved on from that. But there's so much stuff happening in this space with certain pathways, certain mutations. Like there's this whole panel of KRAS mutations and these G12s and all this stuff that's happening. Would never say it's a good time to be diagnosed, but I would say comparatively to like 2010 to where we are today in 2024, right? And what is available, then you take it as it is, right? And hopefully, you get through the next 6 months or the next 3 months, and then this next clinical trial or this next enhancement and this improvement in the targeted therapy, I think is the best term to use here, because I think pancreatic cancer, we just had Anirvan Mietra, who's a big bench scientist out of MD Anderson, and he said, as we evolve in the disease, like we're starting to realize like how the disease works and disease progression, but how specific each patient will have like their own patient, like their treatment protocol, almost
Right.
like a personalized medicine, and that, to your point, like, this NRG1 fusion. It's like half of percent of the cases, right? So there's only a handful of people, but you found, your husband was able to find two more. Potentially there's a lot to learn, from that cohort and eventually possibly a treatment that works really well. And the reason I say this, we brought up cisplatin working really well for BRCA patients. Like we know that, we know that now. Like we're very involved in like high risk screening for this genetic population for BRCA 1, 2, PALPI, ATM, Lynch syndrome, because they know that cisplatin, the platinum based drugs, when you have BRCA patients and you give them those medicines, like we see disease regression and we see disease disappear. So we know it can be done. There's a lot of work being done in the IPMN space, and like I said, there's other things happening, within this KRAS, and in these genes. So it's just a matter. I always say is like you just got to stay in the fight. There's so much happening in science that potentially, in the next 3 to 6 months, we could see a major, treatment protocol change and discoveries that could lead to disease regression and expectancy of life going really high. And something that we talked about before too, your age, right? Like being able to like sustain these types of treatments, I think is also a factor in that as well, because younger people tend to be on the healthier side, don't have comorbidities, and they're able to sustain some of these treatments.
Yeah. Yeah. I mean, thinking back, I think because I was pregnant and because my body was, fueling another individual, I mean, my body is trying to create another life. The cancer was just able to take over because pregnancy, lowers your immune system. So, I mean, they always say, when there's an outbreak, the most sensitive people are elderly, children, people with, comorbidities and pregnant people. Your immune system just isn't at the same level because you're trying to create life. So with a weakened immune system, I think the cancer really had an in and took over. And now that, I'm postpartum and no longer pregnant, my body was able to fight back, thankfully. So yes, the chemo helped, but I also do think that my immune system, came back and kicked into overdrive to help fight this cancer. Not saying that had I not been pregnant, would the cancer have, been there? I mean, possibly in years. But I think that being pregnant, gave the cancer its chance and it took advantage of that. And that's just my theory. I mean, I'm not a scientist.
No, but it's powerful stuff. I mean, again, like I said, you're in this fight, so you're in this, and you're the person in the fight that is going through this, and so that's it's extremely powerful, um, what you just said. So I've got a couple questions here left for you, and then we'll share with our audience where they can connect with you. You mentioned your family early on, your siblings, your parents, your husband, of course, your in-laws. You mentioned both your daughters. And I can't, again, I have an 18-year-old and a 20-year-old, so I can't imagine with a so you have a 3-year-old and a 1-year-old then, right? So talk about the support of your family, because I know we mentioned before, like you went straight into treatment. You weren't, you're not being the mom. And I'm not saying it to upset you, but, just the obvious, like you went straight into, hey, I got to fight this cancer versus, hey, I got to take care of my daughter who was just born. So
Yeah.
what's the support been for your family and maybe some friends possibly too during this time?
Yeah, I mean, it was all hands on deck. My parents, the day I was in the hospital and they told me I had, the tumors, I called them right away and they were up there within an hour. They live about an hour away. So from that day forward, I mean, they've been with us just about every week, if not every other week. So when I go to chemo on Wednesday, it's typically an all day affair, because the treatment itself takes time and they're never on time. So um, my parents pick my 3-year-old up from daycare for us and now actually pick both girls up because both girls are in daycare now. Um, so they've been, an abundance of help in that regard. They'll get my 3-year-olds, ready for dinner. sometimes bath if she needs it. Um, and that's been every single week for the past year. And we wouldn't have been able to get through this without them. And my sister comes, she lives in Delaware, so she's a bit of a ride away, but she comes when she can. And my sister Angela is about an hour away, and she was very instrumental in the beginning with helping, my toddler. Um, and then there's my in-laws. I mean, they live in Taiwan. So once they heard this news, they flew, halfway around the world, and they lived with us for several months. And then, they went back home, and my father-in-law is here right now helping us through the summer with my infant. And my mother-in-law will be here in 2 months. She had her own medical things to deal with, but she'll be back and helping us. And just, thank God that, she's healthy too and able to be here with her grandchildren. And it's kind of been a blessing in a way because, both sides of the family have got to spend more time with their grandchildren than, we would have normally. So, in that regard, it's been a blessing, despite, all of the medical appointments.
Yeah, something that I think we see often though with the disease, and you mentioned a blessing. No one ever asks for this, right? Like no one's asking for a diagnosis of pancreatic cancer, but I think when I've seen in my experience when people are thrown into this disease, it's amazing, like the positive, I guess you would say, that you can find through, the disease itself, of family members, realization.
Hmm. Yeah. And I mean, my sister-in-law too. I mean, she's come with us on the weekends to help out with the girls. And yeah, it's a relationship that my daughter's been able to, create with her that, maybe would not have been there without this situation. So I'm just very thankful for everybody's help and, the opportunity that my daughters have to be with their family. Um, you know, and I've since been out of work. So, I've been more of a hands-on mother since I've been feeling better. So the fall was, our period of darkness, but with, me home and around the girls more, it's, yeah, there are, silver linings through all of this.
You mentioned something earlier on, when the doctor told you to go on the Disney vacation, but you said that she mentioned that, and I'm just looking at my notes here. It said to live like 2 to 3 month increments and to take that. Is that something that you guys are still doing? Like you're still kind of thinking that way or living
Uh,
life that way, or has
yeah,
that changed given like the positive, reaction to the chemotherapy and, being able to get through some of these treatments?
it's changed slightly. I mean, obviously, with every good scan and good blood work result, there's continued hope, and there's less of that darkness that gray cloud that it was
Yeah.
over the beginning. But we've tried to still live by that mantra, if you will. We did go to Florida again in May with the girls and several of my family members. My dad joined us, my sister, my brother. So it was nice to be able to make those memories because we wouldn't have gone to Florida if we weren't in this position as a family. So it's, yeah. So we still try to, do things and make those memories because it is still real. I mean, every 2 to 3 months when I have a scan, you just never know what's the result will be. So, um, yeah, it was good advice of her. I appreciate it. Scary as it may be.
Yeah, I mean, no, it's powerful though. I mean, we've said this and I've said this. I mean, it's powerful what you said because I mean, I think if you look at life that way, you mentioned blessing, right? Like it's like every day. is not guaranteed. We know that, regardless of whether you have a cancer diagnosis or not. We see that
Right.
every day, right? But to have that, I guess, that understanding that, hey, like, all right, we're gonna do what we can do. It's gonna be the best in the next 2 to 3 months is probably so like uplifting in a way. I guess if that, if that makes sense, but also so powerful, like in terms of you're in control of that and you can control that. And, they always say like focus on what you can control and not what you can't control, which,
Right.
a cancer diagnosis is certainly not something that anyone can control. It's kind of out of your hands and you have to have faith in the medications and the clinicians that, that they're doing everything to do what they can to support, you being cured.
Yeah. I mean, I guess through all of this, I mean, one of the very first people I spoke to when I became diagnosed is a long-term cancer survivor. Pretty sure you know her, Camille Moses.
Love Camille.
Uh, just her telling me to keep a positive attitude and, just, stay the path, stay the course. It
Yeah.
struck a chord with me. So I do believe in the power of positivity and prayer. And I think that, always looking to that next 2 to 3 months in a positive way instead of, thinking of the gray cloud overhead definitely helps. Um, so I've always been, if there's a will away, there's a way kind of person.
Yeah.
So I'm, from the outset, been determined to beat this. I never looked at myself as sick. In fact, I didn't even realize I was stage 4. My husband had to tell me that. I was like, wow, the disease was that bad. I had no idea I was stage 4. Um, and when I go to chemo, I, you know, try to go with a smile on my face. And I don't think of it as like a punishment or something negative. I look at it as an opportunity. I mean, I use it to call family members, extended family members that I don't get to see often. I catch up with, people that, as a mom running around, I don't get to text you back right away. So Wednesday in the chemo chair is my day to connect with everybody and follow up with who I can. And I wouldn't have that downtime if I wasn't forced to do it. So
Yeah.
uh, it's just, yeah, it's perspective.
It's powerful stuff. Um, Second to last question here. Given your situation, your age, everything you've gone through, what advice would you give someone listening or watching that's 35 years old that's just gotten the same diagnosis?
Oh man. The biggest one I can say is to advocate for yourself. Because at this age, there's no doctor that thinks pancreatic cancer or cancer even out of the gate. I mean, I'm hoping that more of them are starting to, just because, like you said, there is this, increase in individuals in my age bracket being diagnosed. But I mean, I knew in my gut that something wasn't right. Um, those symptoms I knew were not pregnancy. And if they kept checking baby was fine. So can you look at me now, please? I mean, I know I'm pregnant, but I matter too, not just the baby. Um, so when you know something isn't right, or, just keep advocating. And, if that, grim diagnosis does come, it doesn't have to be a death sentence. Don't Google because that will drive you crazy. And statistics are backwards looking. Those statistics show the past; they don't show the future, so they don't show what you can do.
Oh, it's absolutely true. Statistics are the past. They're backwards looking. And that's really powerful there, given everything that we've just talked about. Last question here, and this is a loaded question. A lot of my questions are loaded, but this one, there's no right or wrong to this, and this is just straight from your experience. How do you define pancreatic cancer? What's the definition for you?
Ooh, that is a loaded question. Um, Pancreatic cancer is, gosh, I don't even know. It is life altering. Um, it is, it will turn your life upside down. I went from, you know, everyday person to somebody completely different. And I think that's one of the things of pancreatic cancer. It's it's a game changer. Um, and your mental health, is impacted too. It's not just your pancreas. It's not just, any organ that it might have spread to. Um, it's a mind game, because now your world went from being one thing to now it's completely different. And your ability to be able to change, with that and accept it, is important. Um, I think mental health with pancreatic cancer or any cancer, is a big deal. So, um, pancreatic cancer is a game changer.
There's no right or wrong. It's your own definition and your experience. And I think the frustrating thing from a patient advocate, Jaclyn, is like no story was ever identical. There are similarities, and I think that's the power of this community, though, is being able to share that. And so I want to thank you from all of us here at Project Purple for allowing us the opportunity to kind of share your journey. I know this cancer can be very lonely. And I think, one of the things, the obvious, as you said, it's everything is like old people. But like I said, like we've talked to a lot of young people, in the last like 4 years. Again, not a conspiracy theory here, but I just think that more people are being impacted by this disease, more moms, more dads that have young children. And so it's powerful to hear your story and your journey because there's a high probability that someone on the other side listening, that maybe in their 20s or maybe in their 30s may be experiencing this similar thing, maybe not today, maybe not tomorrow, but maybe 6 months from now. And I think it's powerful to know that there's other people on the other side having positive results. To your point, like statistics are just looking back, we're looking forward, and there's a lot of positives that are happening moving forward. So thank you for giving us the opportunity to share your journey, and your story, which is loaded with just tons of strength. So I really want to thank you for that. For people watching or listening that want to connect with you, maybe there is someone, that just recently diagnosed, or maybe there's other moms out there that have young children that are going through a similar journey. Is there a place where they can connect, email,
Sure.
social, wherever you want people to go? I always tell guests that just be careful where you point people because they'll come.
Yeah. So yeah, we can start with my email. It's M as in Mary, HAYES, the number 3 at gmail.com. And I'm also on social media platforms. I'm on Instagram as Jaclyn Lin 514. And Facebook, probably more difficult to find me, Jaclyn Marie, with hundreds of others. But if you find me on Instagram, it'll get you to my Facebook page.
Awesome. Jaclyn, thank you so much for allowing us the opportunity to share your journey, your story. It's been an honor to have you on the Project Purple podcast.
Oh, thank you, Dino, for allowing me to share my story. And sorry for all the tears. It's been a very emotional ride.
Never apologize for the tears. I can't imagine, 35 going through this. So it's truly been an honor and no need to apologize.
Thank you.
Thank you for listening to another episode of the Project Purple podcast. If you like today's episode, make sure to share this podcast and make sure to follow us wherever you listen to podcasts. That's a wrap of another episode of the Project Purple podcast. Thanks for listening and be safe.